And as expected, with the rise of COVID cases across the country, mask mandates were sure to return. Joining us now to discuss is cooperative health family physician Dr. Ada Stewart. Dr. Stewart, good afternoon and welcome to BNC.
Good afternoon, and thank you so much.
We're happy to have you with us, and you just heard, obviously, our reporter, Jamise Price, reporting on how these numbers are going up. We need to see more vaccination. So, Dr. Stewart, you were a part of a group of medical professionals that push for mandatory vaccines for health workers. Talk about the work that you're doing right now and why that's so important during this uptick in cases.
Yes, this is really important because right now we're seeing an increase in COVID cases due to the highly virulent strains, including the Delta variant. And then with that, we're seeing an increase in hospitalizations. We're seeing an increase in deaths. And so we really have to do something. We know that vaccines and vaccination is the primary way for us to really combat this virus. And so, as healthcare professionals, we not only have to protect ourselves, but we have to protect our patients, we have to protect our families, and also protect our communities. So, it's really important that we push this. Currently, we already try to recommend that all healthcare clinicians receive their flu vaccines in addition to hepatitis B and pertussis for protection of those individuals who may not, for one reason or another, have been able to be vaccinated. So they're vulnerable to this.
Well, Dr. Stewart, some healthcare professionals are actually pushing back against those mask mandates for workers in that field. Do you think that sends mixed messages?
You know, it's really important that we look at the big picture. We do not want to go back. We do not want to go backwards. We saw the devastation that this pandemic has had on our communities, and we have to really take heed to all of this. We know that vaccinations and masks work and also social distancing, but for us to be able to move forward, to be able to get out of this pandemic, we have to use what works. And vaccinations really work. They're safe. We know the safety is out there. So we have to do all that we can as healthcare professionals to do what we can to not only protect ourselves, it's not just about us, but it's about our patients and our families and our communities that we have to make sure that we stand up and make sure that we encourage the safe rollout and administration of the vaccine, because we, again, do not want to go backwards. We do not want to have those strict mandates that we had previously, and recognizing the impact that it has had on our communities as far as isolations and also individuals not being able to get the care that they deserve by not going into physician offices and things like that. So we have to move forward, and this is the only way for us to do this.
Yeah, I mean, I actually had a loved one who actually recently just got out of the hospital. She got the Delta variant, and she said had she not gotten vaccinated with her underlying health conditions, she probably wouldn't have survived it. So we know it's very, very
Yes.
important. So, Dr. Stewart, do you believe that mask and vaccine mandates will actually help curb the increase in the recent cases if more and more people start to go back to where we were before just a short time ago?
Yes, we know that this works.
Yeah.
The large number of cases that we are having right now is due to individuals who are not vaccinated. So we know that this vaccine will work, because getting your vaccine is the only way, is the primary way for us to be able to get through this. So this is something that we know, and we have to make sure that we encourage it.
hmm And what can actually be done to still encourage people of color to follow mask mandates and get vaccinated? We know that's been a challenge this whole way through.
I am, of course, a person of color, and many of my patients are. And recognizing that, we have to listen to our patients, listen to their concerns, educate them about all the safety and the research that has been out there, address the mistrust and distrust that has been rampant within our communities. And I also talk about the fact that I have received my vaccine and how my experience was, and how I encourage all of my patients. I encourage my family members to become vaccinated. I've seen individuals, including patients of mine, who died due to COVID prior to the rollout of the vaccine. And again, this is something that we do not want to have. It has disproportionately impacted the African American communities. And we have a weapon right now. We have the vaccine and we need to use it.
Yeah, certainly. You're speaking to someone who actually had COVID as well. So the CDC
Amen.
also just announced they recommend children in K through 12 schools wear masks. What does this tell us about what we're learning about masking? What's your reaction to that?
We saw that while kids and individuals wore masks, that we saw a decrease as far as respiratory infections, also a decrease in COVID, in addition to making sure that we protect those who could not receive the vaccines. The vaccines that we have right now are currently have emergency use for those individuals 12 and over. And so those who are less than that, who do not, for one reason, either from age or from the inability to receive the vaccine due to their medical condition, may not be protected. And so we have to protect those who cannot protect themselves. And this is the best way to be able to do this.
Yeah. Dr. Stewart, thank you so much. We appreciate your time, and thank you for all of the work that you're doing to help keep us safe.